As for my mega Republican friends, they say they want to reduce the deficit. We did the math. Based on what we know so far, they could change their minds. Their plans would explode the deficit, increasing it more than $3 trillion over the next 10 years. Here's what they want to do. They want to cut taxes for the very wealthy, again. They want to cut taxes for large corporations. They want to take back the power we just gave Medicare and Medicaid to negotiate, which would raise prices. And they would have a huge giveaway to Big Pharma and cost taxpayers billions of dollars. And if they say they want to cut the deficit, but their plans actually would explode the deficit, how are they going to make the numbers add up? What are they going to cut? That's the big question. For millions of Americans, health care hangs in the balance. Will they continue to fight to cut the Affordable Care Act and make health insurance more expensive for millions of Americans? Republicans have been trying to undo the Affordable Care Act since it passed 13 years ago. They voted to change or repeal the act, it's a fact, it's on the record, more than 50 times in 4 years that it existed. 50 times. And they made repealing it part of virtually every Republican budget since the law was passed, from the Trump administration budgets to congressional budgets to their budget plans for just this past year. So let's be clear about the consequences. If you get rid of the Affordable Care Act, it would mean that more than 100 million Americans with pre-existing conditions would lose the critical protections they have now. The only reason people with pre-existing conditions who don't have private insurance are able to pay is because they have the Affordable Care Act. But by the way, you cut the Affordable Care Act, millions could lose free preventive care like cancer screenings. Millions could lose basic services like maternity care, which insurers would no longer have to cover. Up to 3 million young adults will lose access to their parents' health insurance, which they're on right now, if the Affordable Care Act goes. They're the facts. Not making any of that, as they used to say, is no longer relevant, but Google it, you'll see. And nearly 40 million Americans would be in danger of losing health coverage completely. That includes millions of low-income Americans who currently get their health insurance through Medicaid, which the Affordable Care Act expanded in 39 states. And it includes millions of middle-class and working-class families who currently are covered by the ACA marketplace. Even if they did manage to keep their health insurance, it would cost them thousands of dollars more per year than it does now. That's just a glimpse of the damage of repealing the Affordable Care Act would do. The MAGA Republicans in Congress do they still want to cut Medicaid? Well, the former Trump budget director, who's now advising them, that is the Republicans in the House, on their fiscal strategy, has a plan to slash over $2 trillion from Medicaid. Well, whether it gets passed, that's the plan, okay? He wants to end Medicare expansion under the Affordable Care Act, and then additional deep cuts that could lead to nearly 70 million people losing critical services. Most of them are seniors, people with disabilities, and children. Some could lose their health insurance altogether. Millions of seniors and people with disabilities who depend on Medicaid to help pay for their home care, including home health aides, could lose their ability to remain in their homes. And by the way, it saves the government money if they're home and not in a nursing home. And those long waiting lists for home care, which has gone down under the last 5 years, 20%, would likely rise again, and states with no waiting lists would likely have them again. Medicaid also pays for nursing home care for about 2/3 of all Americans who live in nursing homes. Cut Medicaid, and the quality of care in nursing homes goes down because the help goes down, the salaries go down, access goes down. Rural hospitals across the country that depend on Medicare to cover uncompensated care could close their doors. Already more than 500 rural hospitals across the country are on risk of closing. You know what the statistics show? If in fact you have a serious accident and you're in a rural community, you have a 4 times greater chance of dying than if you had the same exact accident in a community that is more populated. Because you can't get to the hospital. You can't get to many places throughout the Midwest. You have to drive 30, 40 miles to get to a hospital. By that time, you're dead. Not a joke. It's not hyperbole, it's a fact. And so folks, look. In fact, from 2010 to 2021, over 130 hospitals did close. Entire communities depend on these hospitals. Getting Medicaid would shut many of them, not getting Medicaid would shut many of them down. Studies show further that the more likely you are to pass or have serious injury, the further you are from access to a hospital. The time when so many of our kids are dealing with painful mental health challenges, millions could lose access to mental health care as well. At a time when so many of our loved ones and neighbors are struggling with opioid and epidemic, and the millions could lose access to drug treatment facilities. It would be devastating. What about Social Security and Medicare? Well, are they safe? During the State of the Union, as some of you may have seen, I've been around for a lot of State of the Unions. I never saw one where the president got to negotiate in the open with everybody. I was pleased to see so many Republicans stand up. Remember when Marjorie Taylor Greene was yelling, "Liar, liar, Biden's a liar"? I'm going to be good. I'm going to be good. We don't want to cut anything. When I asked, I said, okay, you don't want to cut anything. Everybody who says we're not going to cut Medicare or Social Security, when I asked them to join us and reject the cuts, Medicare, wasn't it something? They all stood up. They all stood up. And they're all on camera. Got all their pictures. Like I said, I believe in conversion. Maybe they found, as my grandfathers, maybe they found religion on Social Security and Medicare. I sure hope so, all kidding aside. But I'll believe it when I see it. For example, Senator Rick Scott of Florida. The guy's been saying for a year, for a long time, that he wants to sunset Social Security and Medicare every 5 years. What that means is every 5 years it comes up, if you don't vote for it back in existence again, with the same, exactly like it was, it goes away. Or you can reduce it. You can do whatever you want. But every 5 years it has to be voted on. Now he says, never mind, don't need to do that. Although I noticed he didn't say never mind about Medicaid and the Affordable Care Act. They're still in the chopping block, even in Senator Scott's plan. Look, make no mistake. If mega Republicans try to take away people's health care by gutting Medicaid and the Affordable Care Act, I will stop them. Folks, here's the bottom line. The work that we've done to get more people affordable health care and bring down the cost is going to reduce the deficit significantly. It's making a real difference in people's lives. It means more security, more dignity for millions of families. We've got more work to do, but we've made a lot of progress.